Before the parents come in, we ask them to take a video of the child asleep. They should be resting, mouth together, quietly breathing, and many times they're not. Children should not snore habitually. Snoring is linked to all these facial disformations, the academic performance, the behavior during the day, the learning capabilities. Many things are altered because of it. If we don't get active and intervene, we're doing harm. If we're waiting, the patients had to suffer more through those formative years with all the comorbidities of the problem. We want to clearly intervene. We've got kids. We don't get a second chance on that time and that moment to intervene for the help of the kids.